Good morning. I think we will come to the next section of practice management, an ethical way. I am Dr. Radharamanan. Along with me is moderator Dr. Thomas Cherian. I request all the speakers comes to the stage. Dr. Rohan, Dr. Sanitha Satyan, Dr. Thomas is there, Dr. Bastin is not here, Dr. Anup, panelist, Dr. Jain Chimman, please. We put it. Dr. Charles sir. So, in this session, we are learning a lot of things in this conference. But we have to learn how to practice and how to enhance our practice. So, there will be this is mainly a discussion wise. There will be some introduction of a few of the topics. So, we will have one person from the government service, one young Dr. Sanitha Satyan from the female entrepreneur, no, that is a better word, no? And from charitable hospital side, Thomas Cherian, and from the private hospital side, I will be talking. So we will start with Dr. Rohan.
Good morning, everyone. At the outset, I thanks for giving this opportunity. When Radharaman asked me to talk about this, I was wondering what I should tell. So, I thought, I'll give the heading like this: you keep doing your work or continue with the mission. It just give you the prescription for the success. So, in government service, as you know, it is not the money which is matter. The work you do will be reciprocated in different ways. So our career actually have so many things like job satisfaction, work-life balance, growth potential, alignment with values, and practice enhancement. Regarding the job satisfaction, it is a pride, respect as a government doctors, even though now the pride has little bit reduced, but we do have some pride that if you do some service, maybe some of our personal matters may be cleared in from some other office. Service to underprivileged community. Of course, we are dealing with community which is of underprivileged, lower middle class people, and they are more like what their feedback will be more good for us. Then clear role and job security reduces stress. So we have a clear job nature, and this reduces the stress. Satisfaction from long-term impact with the public health. So we are incorporating with we are dealing with different types of people and different walks of people. So it definitely gives you energy and some comfort. Work-life balance is one thing everybody is looking for. So we have fixed duty hours in most hospitals, but even though in the duty hours we have to be we have to stretch to your maximum, but after that you are free. Better leave policies and holidays. As you know, in government we have so many types of leave with full pay, half pay like that. So that is available there. And you can always plan it and have time with the family. And also we can incorporate, even in our institute we have now DNP over there. So we can academically also, if you are interested, you can incorporate. And also you can achieve some personal goals other than your profession. Growth potential, as you know, is promotion is like the moment you join, you've been the growth of your seniority is going, and according to the seniority, you will be promoted. Academic growth in teaching hospital. In academic growth also is there in teaching hospital. Research and public health opportunities are there, since we are dealing with the community, we get chance to publish community-oriented things very smoothly. But the career, as you know, is a very slow career advancement. You have to be patient enough and wait, and then only you will, like career growth will go, and it all depends upon you also. Alignment with your values. See, if somebody, it's ideal for those who value public service, equity and social responsibility. Focus on preventive and community health. Prevention is better than cure. That can be done very well from government service. Satisfaction from helping all sections of society. See, nowadays good affluent people also come to hospitals like government hospitals because the infrastructure has developed so high that even the affluent people used to come there. The practice enhancement, actually, the number anyway it will increase, but you try to increase the quality of the work, definitely you will get more affluent patient. And also that, see, you can, if you get affluent patient, I think you are dealing from the bottom to the top. Enhance quality care according to the need, skill development, infrastructure development, outreach activities. You can give health education through digital media, local newspapers representing government blindness control program, involved in policy decision making in our district. So you get a sort of joy and energy by implementing all these things for the common people. So in our hospital, we have infrastructure development. We have done almost, we brought almost all the facilities. Even we have started the vitreoretinal surgery as such. And lasers and all there from the last 12 years. Then we have a mobile tele-ophthalmology unit also. So the unique factors about government service is actually we are not only clinician, but we are also doing administrative work. Government doctors are not only treat patients, but also handle public health administrative management, health camp, and national programs. As you know, the main attraction of government is pension. Unlike private job, government service offers a lifetime financial security with pension, gratuity and health coverage after retirement. Opportunity for national and international level. Experienced government doctors can be deputed for WHO, UNICEF for public health mission abroad or being selected by the central government advisory role. So if you go in that direction, you can reach very high. So when you compare, like it is not like somebody where I'm getting down somebody, it's just job satisfaction, stable, service oriented, but in private it is reward based and variable, work-life balance, better control, often demanding, growth potential slow but steady, but another one it is fast and performance based. If you perform it, growth potential will be faster. Values alignment, public service focus, business and innovative focus. Thank you.
Dr. Rohan, you explained the working conditions in a government setup. Is it that all government doctors by default, they also have to do a good private practice if they want to? I'm not asking about the money part. If they want to get a vertical follow-up of your patients and have a good job satisfaction, do you have to do a private practice, or is it sufficient if you just see the OPD in the government hospital?
The thing is that job satisfaction depends upon the person. If somebody is not interested in straining after the duty hours, then it is up to them. But one thing I will tell you that if you do practice, patients do come, some affluent patients do come, and in that case you have to definitely improve your quality, otherwise they don't come.
My question was slightly different. Suppose I am sitting in the OPD one day and seeing a patient. Next day the patient might come back for a review and someone else might be seeing a patient. But if you have a private practice, the same patient will keep seeing you again and again. That's why I said I'm not asking about the money part.
Okay.
For the follow-up of the patient and have a rapport with the patient, do you need a private practice?
To some extent, but because people who come for your practice, definitely they want to see you. But if you are seeing from the hospital, not necessary that the second person or second time when they come, you will be there. But now we have fixed OP days. So most of the 75% of the people know that this OP day is ours, and they will definitely come and show you. The only thing is that the crowd is so much that sometimes they will be pushed out.
That's what. You made it all rosy. Government jobs were made very rosy. Can you mention one or two challenges in government?
Yeah, challenge is basically they want to improve the quality, but they don't want to decrease the quantity. So this will not go hand in hand. So I had told so many times, like they want to bring in CAS, article, NABH, then so many accreditation. So when they come and talk like we have to improve quality, we have to improve quality. So I asked them whether there is any chance that you can give more employees, right from nursing assistant to staff nurse to the doctors. There is no option for that. Then how can you increase the quality? They didn't answer that one. They want to increase quality. That is the only thing. That's the main challenge there. We have to have, like even in medical college, we know, without reference also people come. But in district hospital also definitely it should come with a reference from the primary PHC or CHC. Otherwise, we cannot maintain quality.
Do you charge from the patients? Just one question.
Yeah, because in our hospital, surgeries, most of the things will be done under CASP. And we do charge for cataract surgery also there, but not that much. But a nominal charge, if the income is less than, I think the ration card color is there. So the very poor patient, we don't take it.
Okay, thank you, Dr. Rohan, for the nice talk. We will be coming to the Dr. Sanidha Satyan. She has already started two or three hospitals. Okay, she will tell you how to start hospital and how to run.
Very good morning to all of you. Thank you, Dr. Radha Ramnan, for having me here. And this makes me very happy because I'm getting an opportunity to share my humble journey in front of my 3 HODs, right from Charles sir, Radharamanan sir and Thomas Cherian sir. Actually, they're sitting sequentially. So it's a proud privilege, sir. And my topic is Taming the Unknown, Challenges and Opportunities for a Young Female Docpreneur. So the unknown is always there. So when you start your own practice, it's like unbottling the genie. So the genie has a lot of potential to, it can actually help you to flourish in your practice and your life. But there is another version of the story also that once you are not up to the mark, if the genie feels so, actually it can eat you up also. So this was when I started my practice in 2018. It was a very uncharted area for me. There were a lot of entrepreneurial gaps, and I had zero prior experience in doing a business or running a hospital, though I was trained in an institute as a surgeon. And there was absolutely no business plan. In fact, I didn't know what a business plan was. And financial investment was, basically I took a bank loan, a small amount, and also with the small money which I had from working in a charitable hospital for 5 years. And poor social capital, that has also to be told, because we shifted town, and in this place, actually I didn't know anybody in that sense. So social capital was also relatively poor. But there was pleasure of doing something new. There was passion and definitely a purpose which pulled us through this journey. So this was my first 2-room, it was a 600 square feet clinic. And this was, I had a single optometrist, and this is my mother. I checked her on the first day, and this was her first patient. And after 1.5 years, COVID pandemic came, and again there was a lot of uncertainty, and we didn't know what to do. But I think the test for any person is how he or she deals with uncertainty. So everything is very smooth, you know, you will get somewhere. But when something so unprecedented came like this, we had, I think, 5 or 6 staff. But COVID was actually good for us. Being a very small practice, we didn't shut the hospital for any day other than the officially declared shutdowns. And we didn't cut the salary of any of the staff. And we checked all the patients who were very desperate to see us for the eye problems. Because they didn't want to go to bigger hospitals for fear of spread of the infection. So I think after this COVID, actually, we had a little bit of an edge and people came to know us, and basically swimming against the tide where you do not know what actually is. And that is a very important thing. And you should actually know what to focus on and what to let go. So after COVID, I thought of expanding my practice. So somebody suggested maybe you can build an OT. So I told, no, I cannot run an OT. It is a big thing. So all those things were, and I don't have the finances to do that. But somehow things turned around, and in 2021, we started a small OT setup. I should be very frank here, I don't have that kind of financial backup, and I didn't want to have any financial backup from my family or my parents or my husband's family. So we just started on like this. It was by brick. So you can do it anyway, that is depending upon your circumstances. Many people here are lucky to have a fully equipped OT. You are a first generation or a second generation ophthalmologist. All that is well, it's all very good things, but for me I had to build brick by brick. And so at the end of the initially it was all second-hand instruments, even my phaco machine. Now I have a brand new OT. It was all step by step, brick by brick. And I think the most important thing that you have to have and you have to build in any practice is a team. And how to build a team? So we have always believed in building a team based on trust and not on fear. So all of us don't want to build a team based on fear, but sometimes ultimately it ends up because your staff have kind of fear in the hierarchy. So we didn't want to do it. It was a very careful team building process which we took, and building authentic relationships was very important. And learning culture, even from the very housekeeper to the doctor, that is always encouraged, and it is mandatory in our hospital, and we are always for continuous quality management. We always wanted to be ethical, and I think we have been always like that, and transparent also, because whatever others think of you, on the go, we'll have a lot of accusations coming up. So I personally believe that if somebody accuses you of something else, another person should be there from your side that she will not do such a thing. So we have had that, we have built up that kind of goodwill. Problems are there, many problems are there, but still. And empowering the team. And when you have empowering the team, we always focus on incremental process. Ours is a very small town hospital. So small town boys and girls have their own advantages and disadvantages. And you cannot expect them to do magic and all, but everything incremental, hand-holding, mentoring that we have done on the way. And the aspiration is to have a flat organizational structure in which the hierarchies are little less, but at the same time, there is a process. This is our team. We make a lot of trips and celebrations also. When I told about the culture of learning, personally I have embarked on, because it was a need, I took a healthcare management executive program followed by an MBA, and I had been an NABH assessor from 2022, which helped me a lot to learn other systems. And we do have academic things also. Regarding the finances, capital investment is always the big thing, and there is a lot of entry barrier to any youngster in ophthalmology. So I think you have to have a mentality of a bear and a bull also. You have to balance between that to build a sustainable and scalable model, and always invest in technology. This I say, you have to start an EMR on the first day of a practice. There is no going other than that. And policy decisions, because I have my own practice, I have been able to do this. We don't have free camps except for the initial 1 or 2 months which I had. We don't do free camps. That is because of my conviction that we do valuable work and I want to get paid for my work. And we don't rely on marketing, only the word of mouth publicity is there. We don't accept any freebies from any, pharma or any other things. And I have chosen to be a debt-free kind of practice. That is also a personal choice because that is not how you do a business properly in the normal sense. And without any compromise on quality or ethics, I want an organic growth and some part of it which I am doing. So basically it is, you need to have roots and wings. That is what we have always stood for. For this, you have to understand yourself, your capabilities and limitations. I'm talking about myself. It's different for each of us. And never overestimate and be overcritical. We do often, as doctors, we do this. And always try to, it depends upon your risk appetite. And getting out of the comfort zone is mandatory. Otherwise, you will be there, you will be stagnant. So this is something which we always have taken care to. Be yourself and grow yourself. Don't be there yourself always stagnant. And all this depends upon what you want. You can have all these things and there is nothing wrong in aspiring for all this. And as a woman, I feel we have more made a difference in care delivery, team dynamics, negotiations, and even financial adjustments as well. So this is a very, we can debate over the point, but maybe in another session. Some challenges which I have come across is, see, however free you are, the society sees you based upon its own patriarchal norms. We are in Kerala, in our country and our state. So I think we have to break it first in your own mind. And going beyond the gender divides, at least in your mind, is the first important thing. And it has been a journey from victimhood to survival to flourishing. So always there is a double standard. How we take up for ourselves is our own thing. And organize yourself as a practice for yourself. You can actually choose to do things what you love to do, have time for yourself and do smart work. And always try to see your practice, try to see your life from an outsider's view as well. And important thing is we have to face our own demons. I think it's all a very personal journey, very philosophical journey in that sense. All of us have this problem of fear of missing out and lot of external competition. We have to be watchful and then we have to decide whether you want to go for it or let it go. Just because somebody else does, it is not at all, it is all your choice. And this I have told, I was a very worrisome person, so I always tell myself, don't worry unnecessarily. See, patience pays. You cannot build a practice on one day, all those things everybody knows in this hall. And patience will come, and we have to be very careful in choosing our battles because we have limited energy, limited time, and we have to make best use of it, and peace of mind is a very, very important thing, which I cherish. So you have to nurture yourself and visualize yourself in the bigger picture and always work relentlessly in small details. I think it is very important. Never get very cozy in your comfort zone. Ophthalmology, even in the whole game of things, ophthalmology is a very small specialty. So keep yourself busy in our ophthalmology because it is our bread and butter. Engage in other fields also. And learn more and smile more. Take it easy. It's hard work, I know, but at the same time, always try to look outside our things also. These are something which I've gathered from my own practice, my own experience. This is not a model thing and all. This is something which I find myself in. And together like this, we can use the genie to make some magic. Thank you.
Thank you, Sanitha, for sharing your journey. All said and done, your practice is one which revolves around you. Because you are the primary ophthalmologist or you are the sole ophthalmologist and you have grown up. From Vettam to Idivetta you have grown. But when do you decide that you need to start your satellite centers? At what point of time?
Sir, now my practice is not dependent on me. When sir visited, I was the only doctor. So now we have 5 doctors, 2 are part-time and 1 visiting consultant. So I have made it a point to build the team and delegate it to a capable team. So now I have gone some way into that. Even if I'm not there also, they are doing the job well. And I don't work, I work only, I work only 4 days in part-time only, but I look into the administrative matters also. I do the surgeries and things. And the second part of your question was?
When do you decide
Yeah.
that you start your satellite centers?
That was because we are though we are near to Kochi, there was a belt which of very lower middle class people who couldn't afford bigger hospitals. So I thought I need to have a center there because there was one place where they had to come through the Kadathu. So we thought we'll just start up a place there. So it's a small center without a operating facility. It is an OP clinic. So that was into after 4 years of my practice.
Thank you, Senator.
Yes.
Not only for the talks and the courage you took up.
Thank you, sir.
Next we will have Dr. Thomas Serian. He has got immense experience in a charitable hospital. So he will be telling about the practice in a charitable hospital. Over to you.
Good morning. Thank you, Dr. Radharamanan. I've had a long journey in a charitable hospital in Kerala, but never thought of putting all this on paper because it just went on and on. So only when Dr. Radharamanan asked me to talk on this, I had to put down a few points. And that was the time when I reflected how I've been working in a charitable hospital for close to 30 years now. The charitable hospitals in India, we have the big ones, the small ones. The challenges and equations are different in each place. Some are owned by religious bodies, some by trusts, most of which are run by non-medical administrators who are less professional compared to corporates or medical professionals, which can at times be an advantage, which can be a disadvantage as well, being less professional. The rules of the institution depends on the administrator, and the priorities are different for each. Sometimes the administrator changes, and the new person might have an entirely different take on how to take the organization forward. In between all this, be productive clinically and otherwise. Your clinical side, your academic side, it should grow up from your own effort, and always stay relevant in your organization. Now, what are the advantages of working in a charitable hospital? You have enough and more clinical work to steady your knowledge and hands. The patients just come in. Once the trust is built in the society, the patients just come in. So any type of patients, you have enough clinical work, you just have to do justice to the work which you are doing. Do an ethical practice, do a sound academic and safe surgical and clinical practice. It is a comparatively relaxed atmosphere compared to the corporate hospitals or a single owner hospital. These places, we have a more relaxed atmosphere. There is no pressure for unethical work and need not take up cases which are beyond your scope. Again, this relaxed atmosphere, it keeps changing off and on, just like the weather changes. Sometimes the charitable hospital, the management thinks that they have to behave like corporates, and at times you have an HR manager coming in, he might be having an experience in some other corporate hospital, might to implement the policies here. The best answer to all this is silence. Many of this dies down in a couple of weeks, and if your silence doesn't work, then only confront. That's something which I learned over the years. The disadvantages of a charitable hospital, the remuneration is not competitive. It's comparatively much less compared to a corporate or other hospital. For the same reason, you might not get the best trained specialists. I've been talking to my director that in a particular specialty, I personally took 5 people up to your door and I went back, but those 5, when they meet me at conferences, they just turn their faces on me because the pay you offered was much less than what they expected. So you might not get the best possible specialists as your colleagues. You can have frequent change of administrators. The policy today might be different from the policy tomorrow. There is a deeply entrenched bureaucracy there. The administrator might change, but the bureaucracy remains the same. the developments take a long time to come through. When you have a new equipment in the market, when everyone is using it, you keep pushing for it, but it doesn't come through so easily. At some point of time, it comes through, and the management's priority may not match yours. You might require a new equipment, you might require a new service to the patient. Management might take it in an entirely different way because they are non-medical personnel. About the fundraising for the hospital, once you have worked for a few years there, then you also add on to the fundraising, not just by seeing patients and adding on to the coffers of the hospital, but these charitable hospitals have relationships with non-governmental organizations. From your part also, you try to foster the relationship with these NGOs, explore new partnerships. Whenever you go for conferences like this or other conferences, you might meet these NGOs, the representatives of the NGOs, meet them, talk to them, invite them to your hospital, let them see the good work which you are doing, and that's how a partnership flourishes. You just connect them to the management, and most of the time it takes off. New projects, when you go out and see something, you feel that it is a need of the hour, you float new projects, you start dreaming, then you start thinking loudly, and then you request someone whether you have some fund to support this project. And at some point of time, some NGO might say, yes, we have fund for this project. For example, when Dr. Radharamanan and I were running a glaucoma screening project, in between glaucoma screening, we had cataracts. Our patients had cataracts. And the glaucoma screening project was a Government of India project, and this cataract would not be supported by the hospital. So what we did is, we just walked into a bank. We just walked into the State Bank of India local branch and met the manager. And the manager then put up the proposal for a CSR fund, and for that panchayat, the cataract surgery was done at that time. This was some 25 years back. So that is how you start working with the NGOs and raise funds for the hospital. And also when you are working in a hospital, the fund comes to the hospital. You please keep an eye on where this fund goes. Because it comes to the hospital, there is a deeply entrenched bureaucracy. The fund might go somewhere. Please keep an eye. Please check. You might not get every single detail, every single paisa. There will be some amount of loss or pilferage, but the gross amount should be in this project, and it should be used for the betterment of the society. So that is your responsibility. When you're working with NGOs, these NGOs in eye care are service organizations. They are donors interested in eye care in India. And Vision 2020 is a public-private partnership. These hospitals, you can take a membership in Vision 2020 and get to interact with more of these people, with the NGOs in eye care sector. There are different eye NGOs, and these are the eye NGOs which our hospital or I have worked with over the years, and each of these NGOs have their agenda. The agendas are different. So before you go and meet an NGO representative, always do a good homework as to see what their agenda is, what is their area of interest before you run into them. And you should have a proposal which suits or matches their agenda, then only the proposals come through. So this is about Christopher Blind and Mission. These are their agendas. For paucity of time, I'm not explaining. Operation Eyesight Universal has a different take. They are interested in comprehensive eye care. Orbis works in field of childhood blindness and diabetic retinopathy. Orbis, as you know, is that flying eye hospital. And Vision 2020 is the apex body of all these in India, while the International Agency for Prevention of Blindness is a global apex body. To conclude, you work on a project, convince the NGOs with your track record, do a good reporting. The reporting should be proper and it should be periodic. There should be a strict maintenance of accounts and trustworthiness. And once you work with NGOs and prove your mettle, many of the government programs also come to you, because the government, especially the central government,
they cannot implement programs directly. So they approach hospitals which have a good track record. And when these government programs also come, you have to be even more careful about where the fund goes. So that part we have to take care. And before I conclude, let me give a word of wisdom which was taught to me by my boss, Dr. T.P. Tiera. When there is a director who is interested in construction in the hospital, try to get a good building. If you keep pushing for the instruments, you'll neither get the instrument nor the building. And directors keep changing. Tomorrow the atmosphere might be different. There'll be a new director who will provide you with the equipment which you need. So that's the words of wisdom which was taught to me by Dr. Tiera. And so the take-home message is: do good clinical work, put your heart and soul in your work, get involved in the social and cultural activities of the hospital, interact with donors, be the contact point of partners, attend meetings, contribute to the meetings, and when the writing is on the wall, stop. Thank you.
Thank you, Dr. Thomas Arian. Actually, this is so many decades of experience, and a person like Dr. Tiera sir used to sometime very sarcastically or somewhere wisely he used to tell, but always he tells the truth. So this is the way we can survive it.
Thomas, I have on whether this charitable hospital and private patients can be run in a small scale. I mean, a single practitioner can manage.
You mean a practitioner starting a charitable hospital, can he have a private patient?
You combine both.
Yes, very
both.
much.
But to start a charity, how long you should work, that hospital has to function for this much of years? Any standard pattern is there?
I'm not very sure about that, because I started working in a hospital which was already well established. Okay. So I don't know about the rules and regulations of that.
So I think anybody can start a charitable trust. I don't think this many years you need to. Only thing whether you will get funding, that is what you're asking. So that requires, of course, you need to show a body of work. They should know that you are sincere. And one thing, Dr. Thomas, is that Arvindaya Hospital, they are also a charitable trust hospital, and they have shown that it can be a very viable and profitable business model. So wouldn't that be something which can be copied or emulated across the country?
Yes, that is done by almost everyone. All these charitable hospitals are profitable. There is no question about it. And even when you are doing a free service, that is also profitable to the hospital.
A lot of the things which you said initially, the disadvantages were something resembling that of a government service.
Yeah, the profit doesn't trickle down to the employees, that's all. Yeah. The hospital is always profitable.
Okay.
Okay, thank you, Dr. Thomas. I'll come to the last talk and we'll discuss it after that. This is a question we faces now. Actually, do we have enough space for all private hospitals in Kerala? So the number of private hospitals are increasing day by day, and this is a question. I personally believe that yes, we have enough space at present. The second question is whether there is a healthy relationship between doctors, between these hospitals and doctors. So sometimes it's not that healthy. That is what few years. Whether there is a breach of ethics in this tough competition. I think we have to keep ethics also to some extent. There is no need to break the ethics. So coming to the first question, whether we have enough patients for all these private hospitals. This is a National Blindness and Visual Impairment Survey conducted in 2015-19. So it was conducted all over India, and Trichy district in Kerala was a part of it. And they defined blindness below 3/60, like all other things. I am not going into the details about the thing, but they have found that 618, and that is point they find out is a visual impairment of that thing. So blindness was 1.99%, and the visual impairment was 13.76 above the age of 50 years. So among that thing, cataract was definitely the highest number of blindness. So we extrapolate this number into the population in 2017, actually 8 years back population. Actually, below 50 years, it was 111 crores plus, and above 50 years, it was 21 crores only. So when you find it, visual impairment is 3 lakhs, 34 lakhs. But in the Kerala situation, I am just telling about the all India situation. It is totally different in Kerala, not totally different, but it is different. What is the vision at which we advise surgeries? This statistics and all is telling about 618. Definitely we know that in Kerala now 618 is not the vision. So it is much below that thing because patients are educated, they want to read, and also the competition also and the practice also is putting some pressure on the reduction in the operating vision less than 618. So it is not the 13.76 below 618, that is all India this thing, that is also above 50 years. In the last WHO calculation published, they says 1/5 of our population are senior citizens, that is above the age of 60 years. That is the main difference between all India position and the Kerala position. Here the older population is much more compared to an all India situation. Life expectancy in males are 78 and females are 82. So Kerala, if you take 1/5 of the population, around 70 lakhs plus are there. So 612, if you bring down to 612, it will be around 25% of that thing. That is if you consider one eye alone. So 25% of 70 lakhs is around 17.5 lakhs. What I am trying to convince is some around 17.5 lakhs patients are there for operation now. So this is information I got it from the government that last 23-24, it was 2,51,000 surgeries are conducted in Kerala. So that means we have enough cataract to operate it. That is based on around 612 vision, not based on 66 partial or 66 vision. Then it will be much more than that. So we have enough patients. But if the more and more hospital comes, then it will be a little more tighter. But now there is definitely there is a chance. Definitely what we are discussing is how to enhance the practice in private doctors and private eye hospitals. As Thomas Arian mentioned, the charitable hospital as well as in private hospital, most of the time we have non-ophthalmic managers. So they will advise you only in two ways. One main thing is really advertisement. And second thing is sometimes they will tell you about a fee sharing. That is a good word I use. If they are telling these two words only, then it is very clear that they don't have any idea, because this any fool can tell you. But when you look at the hospitals having the maximum number of patients, these type of hospitals, they are not giving any advertisement, they are not giving any fees to the referring doctors. So what it proves is, it is not the way by which you get the patients. So it's a clear cut. When you look at the population, look at Kerala, you should see that which hospital is getting maximum patients and what is the way at which they are getting the patient. That is a simple technique. So the second, the commonest technique in Kerala is conducting camps. That is a way of indirect advertisement. This for the charitable hospital as well as the private hospital, everywhere it is conducted. I think other than Dr. Sanida, everyone is doing it. most widely used and a time-tested technique, because even outside the states hospital also is conducting. And charitable hospital also shifting from total free to concession and selected free. That is good. Private hospital also gives discount and sometimes to a full rates also. Some of the camps are totally screening process only. And there are other ways by which you can enhance your practice. That is what is happening is World Sight Day, Glaucoma Week Day, everything. That actually increases your practice as well as others' practice. When you give a glaucoma awareness classes to everyone, more and more patients will be going to the hospitals, doctors, not only to you, other people also. And there are newspapers also. Their interest is different. They won't have any, whatever they tells, they are only interested in money. This is another way, because it's not the usual thing. This is what I am telling you is about what we have followed it at some places. We always concentrate on ophthalmology. Don't think that only concentrating in ophthalmology is the method of enhancing your practice. You do it in other way also. That you will convince the population that you are not for only money and you get patients. So this is some of the things we conducted. Actually, this enhanced our practice. Actually, with the enhancing, that was not our purpose, but indirectly we got a benefit out of it. So, how we increase this thing? Very simple thing. It is all depends upon a demand creation. The only thing is, sometime accidentally, we create the patients on demand. So they will be demanding. Some of the advertisement, some of the methods what we adopted finally works against you. So this should be such a way that patient should come to you. So don't go to the patient very forcibly, that indirectly will work on other way. So sometimes you will be giving coupons and all that. They will demand more and more. Sometimes you get all of a sudden you get some patients, but on a long run, it is not that. Mouth to mouth is actually an excellent way. How we will make it on our demanding side? Make sure that you have the best equipments. You look at the good hospitals what I am telling good hospital is, number of patients are more. You see that they will have good equipments, best facilities, and indirectly show you a result. And most of the people, what they are doing is they will put a testimonials in the website. And most of the people in social media, they are aware how the testimonials are going on. So don't think all the patients are fools. So show you a hospital in a good way, not only in ophthalmic, education, everything you can do it. Showcase your services. You can showcase not only in a direct way, you can showcase it everything in an indirect way, and patient will accept it. Whenever you are going that I can do this thing, I am the best, I am this thing, they won't someday accept it. If there are some persons, some other groups explaining about you, then it will work very well. And reduce the delay in your hospitals, because nowadays patients all wanted fast service. But you know that it's all the delays, we cannot reduce it, because some of the cases you have to dilate and you have to test it. But the important thing is you have to tell the person or patient why that delay is there. Do not tell any bad comments about the your colleagues. Simplest policy is affordable rate and quality services. The rest of the thing will happen. Advertisement usually bring some patients initially, but some of the patients, the advertisement will make unhappy also. So always look around for the good examples, learn from the established persons and hospital, look which hospital having high patient, that is what I was explaining all this time. Observe their techniques, observe area actively promoting hospitals and not having patients. You can learn the negative things from them. You will learn what you should not do from them. Never listen to high profile business persons who have never run even a small tea shop. So they will take classes. You have to be careful. Take advice and help from the right person. So some of the people will be helping you in all these days. So you take advice from them. So thank you for your kind attention. I think we'll come to discussion, some discussion.
Sir, I have a, I have two comments to make on the statements. One thing is, sir told about 17 lakh people and we need more hospitals who require. But like when we say about India, India is a very wealthy country, but only 4 or 5 people are holding the most of the wealth. The same thing applies to our scenario also. So when, as many bigger hospitals across India also, they do most of the cataract surgeries, and a very young practitioner who is into the field, the entry barrier is very high with our lot of equipments, and they practically do not get any cataract surgeries. So there is a disparity in the distribution of cataract surgeries, and the numbers doesn't reflect that. And the second thing is when we talk about the free camps. So I told almost everybody is doing camps, and being a teaching hospital, we need to do camps. But at the same time, what happens is our patients, we have taught our patients to choose their doctors. And the price of the surgery has also, we have undercut so much that that has become the norm. So we have become like any retailers. So I think we are spoiling our credibility. Like yesterday, the chief guest was saying that now we have kept our dignity among the other professionals. But I think maybe the society should also think about that distribution.
Anup, any comments on this? Whether advertisement is must in developing the
Advertisement,
practice?
I think, to some extent is necessary in today's world, because everything is driven by advertisement, and people are, before they go to any place, they do see. They go, because even if we go to a new place, we always go through all the reviews and all, especially if you don't know that place. So I think it is important. But to a limited extent, not to the content of the advertisement should not be like selling something. It's more like advertising your product, what facilities you have, or what services you give, those sort of things. That again is two ways, the good advertisement and a bad advertisement. And but another thing which I found now, because that impatience, that as soon as you start, you want to be successful. That patience is not there for it to grow brick by brick, like Sanita showed in her. In the last so many years, she has built up to this level. So that sort of patience is not there among many people who are starting. They want to become success immediately. That is why they, I think, adopt a lot of all these. What fee sharing you said, basically it is cut practice, I assume. So that sort of thing, I think, is it's really spoiling our image, and probably next time we call Dr. Jaykumar as a chief guest, I don't think he will tell what he said yesterday.
Okay, that is that. Actually, one way we also feel good about what Dr. Jaykumar sir told, because that is a general impression. Ophthalmologists are the least corrupted people in the community. So we are all proud of this thing. And there is another thing I was telling to one of the minister this thing, that you see that ophthalmology is the flex-free community. So you travel all over along the Kerala, you will see that some flexes showing that give donations for this person's practice, treatment, and donation for the another person's. But you won't see anything like Basin, do you think that camps are necessary for practice management?
Sir, in the initial phase, it's necessary. But nowadays, without camps, you can't survive. That's my experience.
Then about the social media, what is the role of social media in our practice enhancement?
In my experience, we started our hospital some 23 years back. And in these 23 years, when I checked the, reviews, we had 97 reviews only. But when I checked some hospitals which was started recently, maybe 1 year or 2 years, 1 year back, there that reviews were 5,000. So I feel so many people are coming to hospitals searching for these reviews only. So it has a role, but whether we have to promote this kind of custom is debatable.
So whenever you see more than 4 in the rating, so some people take it as little suspicious. What Thomas think?
Our time is almost up. We
Okay.
have to wind up.
Okay. So, okay, thank you all the speakers, all the delegates. Thank you.